Golden Opportunities is paid for by Elder Productions.
Hello, I'm Lori Steiner. Welcome to Golden Opportunities.
Today, we'll offer an update from AARP Ohio. Then, we'll help to turn your frown upside down. We'll present the positive points of receiving palliative care. Plus, we'll focus on bringing out the best in our favorite furry friends. And if your kids are in college, we'll detail important documents you should put in place.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. It's back to school time, and as students crack the books, it's often discovered that some children fall through the cracks when it comes to refining their reading. And that's where you can help. Ross Jones is here to teach us about AARP's Experience Corps, which is operated through Greater Cleveland Volunteers. Ross is the program manager. Welcome to the show.
Thank you very much. Appreciate being here.
What is AARP's Experience Corps?
AARP Experience Corps is a program that is, we've been associated with Cleveland Municipal School District for about 18 years, and we engage seniors 50 and above to help tutor kindergarten through third grade kids in literacy.
Okay.
We've been doing that for quite some time, and the kids that we have, we want to get them to be able to read by the time they get to the third grade.
Why is that important?
Because mainly if a child does not be able to read in the fourth grade, the likelihood of them graduating when they get to high school, they will not graduate.
Oh dear, so it's really important.
Exactly.
And you do that through these volunteer tutors.
That's correct. We have a number of tutors. Last year we had about 150 some tutors tutoring kindergarten through third grade kids in 17 Cleveland schools.
Wow.
And we try to recruit all year long as many tutors as we can get.
So you need more, I'm assuming.
We never have enough tutors, I'll tell you that right now. We lose them for various reasons. And so we have these tutors, they tutor from all the way from September all the way to May, so it's a big commitment, but they're committed, so we appreciate all that they do.
So what is the benefit for the volunteers?
A lot of benefits. One is they love working with the children. They love being out in the school, in the community, working with their peers. And we have tutors who have worked in the program for over 15 years.
Boy.
So the return rate is very high.
And the kids really benefit.
The kids, for the most part, that's our main focus. They get a chance to be with an older adult. We also, in addition to tutoring, there's a mentoring aspect. Their behavior is better, their class participation is better, and again, their scores and their reading level goes up.
It just helps everybody. What kind of time commitment do the volunteers have to make?
We had a drastic change this year. We had tutors who used to commit to 10 to 15 hours a week for 7 months. This year there's going to be some changes. So this year it's 4 hours or 6 hours a week, and they tutor a minimum of twice a week. So that's basically what they have to commit to.
So they get training?
They get training. They go through the interview process, application. We do a background check, FBI, BCI. We don't throw them in what we call cold turkey.
That's good. I get a little confidence for those tutors.
Yes.
You also have something called a Books for Kids program. Tell us about that.
That is correct. Basically, we collect books from a variety of sources. Books for Kids donates books to us, Half Price Books, individuals, companies, and what happens is we take those books and we distribute them to the students at the 17 schools. Christmas time, they get books. Easter break, they get books, and then we
instead of candy?
And at the end of the school year, we do a summer packet for them to take home to carry them over until school starts. So we distribute about 5,000 books a year. Yeah.
That is so great. How do people get involved?
Basically, if they want to get involved, either want more information, or if they want to become a tutor, which is our main focus, or they want to donate books or have a book drive. We have book drives also, and then they just send the books to us. They can reach me at 216-391-9500, extension 119.
Alrighty, and I think we have up on the screen too a website that they can go to also if they're computer people.
That's correct.
Thank you so much for this great information.
Well, thank you for having me.
You can make a huge difference in a child's life and your own by becoming a volunteer tutor. So if you feel like a classroom is calling you, be sure to call Greater Cleveland Volunteers and sign up. Use the information that Ross gave us or the number that's coming up next. My thanks to Ross for a wonderful lesson in how to help others.
For more information, call AARP Ohio at 866-389-5653 or log on to www.aarp.org/Ohio. Next, teeth treatments. But first, there's an animal that we eat before it's born as well as after it died. And while that may sound morbid, each dish is delicious. Can you give the answer to which animal this is? We'll serve up the solution when we return.
Right now, the trusted experts of University Hospital's Seidman Cancer Center and the most advanced cancer-fighting technologies are in 17 community locations. That's leading-edge care, where you're most comfortable. That's UH Seidman Cancer Center. Right now, proton therapy, a revolutionary treatment for many types of cancer, is available for the first time in Ohio, and only at University Hospital's Seidman Cancer Center. That's the future of cancer care. That's UH Seidman Cancer Center.
The most popular animal eaten before birth and after death? The correct response is the chicken. But the answer to that other lingering question, which came first, the chicken or the egg, remains a mystery.
There's only 3 months left in 2017, but that means there's still time to take care of your teeth while making the most of your healthcare money. Dentist Steve Marsh is here with timely, cost-conscious tips. Welcome back to the show.
Thanks so much, Lori.
So first we're going to talk about dental insurance.
So dental insurance in the past was really a wonderful benefit. Today it really isn't. It's $1,000 to $1,500 a year with most companies. Having said that, if you have unused dental benefits going to the last quarter of the year, it's a shame to sort of leave it on the table and not use it. So that makes this time of year a very good time to start with your dentist, or not start, but continuing with care and maximize what you can get from them.
Yeah, you might as well. And also, many people have health savings accounts or HSAs, there we go,
sure.
With their employer, and that's just you're setting aside money for health expenses later on. So how does that work with dental?
Well, so the nice advantage of that is if people want to put aside money before it's taxed, they can use that for health care. And so if you need restorative work that can be done in a cosmetic manner, it's a wonderful way to, again, use that money. In some cases, and you may know more of this as an attorney, but in some cases, if you don't use that money that's put aside, it's hard to use it the following year. So again, if you put money away near the end of the year, don't let it go, because it's your own money that would have been yours in your pocket.
It may or may not roll over to the next year, so you really have to pay attention.
Yeah, so this is a patient who came to me, and she had dental insurance. She's a professor. She actually was a guest of the show and a Golden Opportunity viewer. So she was a professor at Overland, still is actually, and a fine person, and never liked the way she smiled. And again, she's in front of people all the time. So we did some gum contouring. Again, we do that with a laser today. It's called a diode laser. It's very painless, actually, and then we put 4 veneers. She had X amount of dollars to use before the end of the year. She also had some fracturing, so we used it. And here's Jody sitting with me on the set of WKYC on her visit to Golden Opportunities. But she was thrilled with it, and then the next year we did some more work. This is a guy who's actually a very good friend of mine. He's a physician. He went away or moved from Cleveland, just recently moved back. His teeth were actually quite mobile, so he did have some periodontal disease, and we had to take some teeth out. The reason we brought him in, and there he is with the teeth out, is that he had an HSA account that he established when he came back to work as a physician in Cleveland, a wonderful one, where he put away a lot of money because he knew he had this coming up, because he had known the shape of his teeth. We looked at options. We did porcelain bridge work, again, not a candidate for implants, but look how beautiful those bridges. Those are permanent.
So different, yeah.
He did it that year, and the following year he put some more away. So we talk about HSA, we talk about people who have had insurance. This is a patient who wanted to get some work done before the end of the year. She was a government employee, never liked the way her teeth looked, and again, did it so that she started this last year in the uppers. We reshaped them, did some porcelain crowns, and gave her this beautiful smile, and now this year she's done more work on it. Okay, so these teeth have actually moved a lot over the years. You can see how they've moved. A woman in her 60s said, listen, I want my teeth done. I want them to look good. I'm not going through braces. I've had a lot of medical expenses, which is another reason. And she said, if I do my teeth, that'll just add to my medical expenses. As you know, Lori, there's a certain level, a threshold, and then some of it gets deductible. So she said, I've been waiting, let's do it now. And this is a woman who came to me for none of those reasons. She had a lot of problems with her teeth. They were worn down. Her sister brought her in and said she's worked as a teacher for all these years. She hasn't used all her insurance. She's had money put away. In her upper arch, we weren't able to save most of those teeth because of breakdown. That's an upper denture, but it looks hopefully just like real teeth.
It really does.
And in the lower arch, we reshaped them. We did some gum contouring, did some porcelain veneers, and so she was able to use some of that money that she had put away from teaching all those years. So there's a wonderful reason to get your dentistry done, whether it's insurance, whether it's an HSA, whether it's taxes, or maybe you just need dental care, and you know it's your time of year to do it.
All right, great. Time, money, dental saving tips.
Thank you.
And time is money. Make the most of both by treating your teeth and restoring your smile now. For help, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, the importance of palliative care for many conditions. Looking for places to go, things to do? Welcome to our community calendar. Bacon beer and live bands. They're all a part of the East Bank Bacon Festival, Saturday, October 7th from noon to 10 p.m. Besides music and munchies that go easily with ale, this event will really bring home the bacon for the Hunger Network, since 100% of the proceeds will go to help fight local hunger. To chow down on the details, call 631-338-7711 or visit www.flatseastbank.com.
Palliative care is a new term for many people. For those with serious, life-threatening medical issues, it's a welcome approach to caring for these complex cases. Dr. Elizabeth Weinstein has joined us in the UH Broadcast Center to explain this type of treatment. Dr. Weinstein is the Medical Director of Palliative Care and Cancer at University Hospitals. Welcome to the show here for us today. So what exactly is palliative care?
Palliative care is specialized medical care for people with serious illnesses, like you said. Palliative care aims to attend to the whole patient, so physical symptoms like pain and the stress of a serious illness. Palliative care tries to take care of not just the patient, but their family and loved ones. And to do all those things, we work in a multidisciplinary team. So we have doctors, nurses and nurse practitioners, social workers, chaplains, mental health specialists, to name some of them.
Wow, okay.
Palliative care is appropriate for people at any age and any stage of illness.
All right, so how is palliative care different from hospice care?
So that's a great question. We both have the same goals of attending to quality of life. Palliative care is a big group, of which hospice is a smaller component of it. Hospice has some regulations around it that deal with prognosis, and at this point in time in healthcare, people need to either not have options to treat their life-limiting illness, or they may choose to forego them, in which case they would be eligible for hospice care. We're both, though, palliative and hospice care, aiming to attend to the patient and their family and prioritize quality of life.
Okay. Is palliative care offered only in a hospital setting?
So, no. Palliative care is in hospitals, and some hospitals have specific places that they have a palliative care unit. Sometimes the team goes to the patient wherever they are, but palliative care also can be offered in the outpatient setting in people's homes, or if they live in assisted living or nursing home, so lots of places.
Okay. When is palliative care actually presented as an option? I know most people get into hospice too late, so is that the same kind of problems with palliative care?
So sometimes healthcare is just sort of figuring out how to provide palliative care, and institutions are at different stages of that. So the hope would be that it's offered early in the diagnosis of a life-limiting or serious illness. If you think it's something that's appropriate for you or your loved one and no one's talked about it, it would be fair to ask about it and try to advocate it for you or your loved one.
Now we know about it. So
Right.
what difference in patient quality of care have you seen with patients who are getting this palliative option?
So there's a nice body of evidence now to support the integration of palliative care, and it has shown that palliative care, when added to standard medical care, shows improvements in patient quality of life and satisfaction and caregiver satisfaction. And amazingly enough, when you talk to people about palliative care, they often would choose that path for themselves, and a happy side effect in a health system in crisis is that that doesn't tend to be the most expensive medical care. So it's also showing some cost savings.
Okay, excellent. Thank you so much for talking about this kind of a not new, but new to many people option.
Yeah, my pleasure.
When you have a team of healthcare professionals providing quality care across a variety of specialties, you have the result of improved quality of life for the patient and for their family. This makes it easy to understand the importance and effectiveness of palliative care. My thanks to Dr. Weinstein for sharing this information with us today.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth. Next, chew on this. It's time to get up and go, an exercise segment on golden opportunities.
Hey everybody, it's Mike Carbon from Breakout Fitness, and today I'm going to show you how to work the quads in the front of the leg by doing a single leg squat. You ready to go?
I hope so.
Let's do this. All right, we're going to start by making sure that you have some firm surface next to you just in case you get in trouble. From here, what we're going to do is we're going to put all the pressure on the right leg or the left leg, whichever you choose to start with. The opposite leg is going to go out to your side, toes pointed towards the ground, and we're simply going to squat down as we lower that leg out and up. Okay, make sure that firm surface is next to you just in case you get in trouble. 12 to 15 repetitions. Make sure your knee stays in alignment with your shoulder. It should not buckle in. Lori, how you feeling?
Oh, I need this firm.
There you go. You're looking good though. Not too bad. Yeah, not too bad. Utilize your chair.
Yeah.
Excellent. That's perfect. All right, everybody. 12 to 15, 2 to 3 sets. And now it's your turn to get up and go.
For your copy of the exercise booklet, send $1 for postage to Golden Opportunities, 6105 Parkland Boulevard, Suite 140, Mayfield Heights, Ohio, 44124.
We know we should take good care of our teeth, but did you know your dog or cat's dental health is also important? Dr. Earl Rogoff is here to tell us why our pets need proactive protection for their teeth, just like we do. Dr. Rogoff is a veterinarian and the owner of Orange Village Animal Hospital.
Well, good morning.
So good morning to you. So are we talking regular twice annually checkups and flossing and...
Well, flossing may be pushing a little, but brushing your pet's teeth, I mean, statistically, 80% of all dogs and cats over 5 years of age do have periodontal disease in one form or another.
Wow.
I mean, we see cavities and we see root canals and same kind of things that you see in people. There's even dental specialists for your dog and cat.
Seriously?
Yeah, they can put caps on, in severe cases, braces.
That seems a little excessive, but...
I think so. But if sometimes the bite is so severe they can't close their mouth or they're in pain,
they can't chew
then
or
I can
whatever.
see, if they can't chew.
Okay.
But other than that, the big thing that people don't realize is the bacteria that form the plaque and tartar on the teeth also get into the bloodstream, and they can affect the liver, kidneys, and heart of your pet.
Oh my, okay. Well, hopefully it doesn't do that to people too, but so should we be brushing our pets' teeth?
Absolutely. And the best thing is start when they're young, even just doing one tooth at a time, or even with your finger, rub their teeth, get them used to having their mouth held. You want to use a very soft toothbrush, and then you also want to use toothpaste designed for dogs and cats. Human toothpaste have detergents that aren't designed to be swallowed.
Okay.
And since they can't spit, they have no choice but to swallow it.
I don't suppose the dogs and cats would like the minty fresh flavor
No,
either.
they don't. But start slowly, get them accustomed to it. And if you can do a little bit once a week, and over time, you get to all the teeth.
All right, well, we have a dog. I guess we're going to have to start looking into that. She's only 3 yet, so.
Well, that's a perfect time to start. And their teeth should be white. As you can see in this picture, they shouldn't have the brown staining. On the left is before we clean them. On the right is, you can see after they're clean. But an animal's mouth should not have a foul odor. The teeth should be white, gum should be pink.
Okay, well, what happens if you haven't done the brushing and at some point it's a problem?
Well, eventually the tartar will build up. You can't brush it off at that point. They do need to be professionally cleaned. It does require anesthesia to properly clean their mouths. You can sometimes scrape the outside of the teeth, but you can't get inside the teeth along the tongue and clean them with them awake.
And you don't want to have that done to those poor little puppies and kitties. That too often,
It's a lot of stress. But typically by the age of 5 or 6, you really need to start having their teeth cleaned. One thing that also happens, and you can see with these pictures, even though the teeth look pretty clean, there's still a broken tooth in this picture, and there was a cavity in the picture before.
Oh dear.
So get in the habit of lifting up your pet's gums.
And actually look at them once in a while.
Yeah, and look at them.
Those big canines that come out.
They should be, white and shining at you. If your dog, enters the room and the breath knocks you out of your chair, it's probably a sign something needs to be done.
All right. Well, good advice for our pets. Dr. Marsh helps us personally, and you can help us with our pets' dental care.
Take that same advice and carry it on over to your dog or cat.
Sounds good. Your pet's pearly whites need consistent care to keep your dog or cat healthy and happy. For help, call Dr. Rogoff. His number is next.
For more information, call the Orange Village Animal Hospital at 440-248-0151 or log on to www.ovahosp.com. Next, term papers.
What do Trump administration initiatives mean if you have $500,000 or more in liquid assets? They mean complex challenges and exceptional opportunities. Hi, I'm Jim Lineweaver, president of Lineweaver Wealth Advisors. To learn more about these challenges and opportunities, we've organized a panel of financial, tax, and legal experts with over 30 years' experience. Please join us for dinner at the award-winning Hyde Park Prime Steakhouse. Dates and times are on your screen. Call today. Complimentary dinner seating is limited.
As your child or grandchild heads off to college, you feel a sense of relief, and of course, you feel sad too. You've purchased the dorm room supplies, and you're prepared to drive, fly, or otherwise get them to the church on time. The school on time. Is there something else to consider? Here to talk about one last bit of planning before your child or grandchild heads off to school is my law partner, Mike Solomon. So welcome back, Mike.
Yes.
Now, Mike, your kids are already gone to school and they're done, so you're a pro, personally and professionally. Yes. So what advice do we have for our parents and grandparents?
Well, as your children get older, you have less and less control. I found out, by the way, around 2 years old, you start losing control. But anyway, by the time they're 18, they become legal adults, and you need permission. You can't do what you've been doing up to that point. You can't call the doctors, you can't deal with their banking or anything like that.
Okay, so assuming your child actually wants your help, what do you need to do?
Well, there are three important documents you should focus on. A healthcare power of attorney with a HIPAA document, a financial power of attorney, a durable power of attorney, and a last will and testament. Those are the three important documents.
Okay, so can you explain what these documents actually are for?
Well, the healthcare power of attorney is a document that gives you the right to make medical decisions for your child once they're 18. When they're under 18, of course, you always have that right. But once they turn 18, you can't talk to their doctors or anything about any of their medical issues. If you have that document, if they're unable to make the decisions themselves, then you can make those decisions. If you don't have that document, let's say they're off in college and they have a medical problem, you can't do anything. You'd have to get a guardian. You have to get guardianship appointed.
Oh, boy.
And that takes time and effort and money to make medical decisions for them. Same thing with a HIPAA document. The healthcare power of attorney with a related HIPAA document will allow you to look at their medical records so you can make an informed decision.
Okay. How about paying bills and accessing your child's or your grandchild's financial information?
Well, it's the same sort of thing. Up till 18, you're able to pay their bills. They can't sign a contract. You do all their financial stuff. Once they're 18, they're an adult. You don't have a right to go to the bank and find out what's going on with their bank account. You can't deal with the colleges regarding payments of tuitions or anything like that. You need a financial power of attorney. Most people are familiar with it. They probably do it already for themselves, but for your kids or grandkids so that you can make legal decisions for them. And if it's a parent, you might want both parents on the document, so if one's not available, the other can do something.
Because they sure want you paying their
That's
bills,
right?
right?
That's right.
So that sounds really important for the healthcare and financial. But you mentioned a last will and testament. Why?
Well, this maybe is third on the list. I mean, they're 18, so there's less of a risk. But a last will and testament will address what happens if they pass away. Now, if they pass away without a will, you can still do it, but it's much more cumbersome. So it's better to have a will if you can get one done.
Okay. And on a different note, I understand that you're going to be participating in some seminars coming up.
That's right. We're doing some seminars with the Lineweaver Financial Group, a sponsor of the show. We have it coming up in a few weeks. It's in Beechwood at the Hyde Park Restaurant. They're going to have 3 panelists, myself, Jim Lineweaver, and someone else from his office talking about financial issues, estate planning, tax issues, all sorts of things that are relevant to people. I've done it before. They fill these things up fairly quickly, so you ought to call with the number on the screen there, hopefully, and make a reservation.
And maybe you should throw in a few things for the parents and grandparents
That's
for
right.
their children
That's
and
right.
grandchildren,
That's
like
right.
we've talked about today. Seminar sounds great, but getting back to today's topic, if you have a child or a grandchild that's approaching adulthood and heading off to college, now is the time to consider these important documents. And you need to reach out to your estate planning attorney to help guide your child or grandchild. Now remember, it is their choice though, but you need to help them make the best one. For help, give Mike a call at the number coming up next.
Call Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.ssnplaw.com.
Thanks for joining us. On next week's show, we'll identify innovations in breast cancer treatment. Then, baby boomers are exploring a new employment option to raise their retirement revenues. We're on the job with more info. And enrollment from Medicare Advantage programs is now open. Imagine that. We'll cover what they cover. Until then, though, please remember to make the most of your golden opportunities.
If you'd like to join our kitchen conversation, visit our website, www.goldenopportunities.tv. Like us on Facebook. Call us at 440-742-GO-TV or email us at kitchen@goldenopportunities.tv. We'd love to hear from you.
Golden Opportunities is paid for by Elder Productions.